I'm Dr. Reginald Coopwood, CEO of the Metropolitan Nashville Hospital Authority. I am passionate about healthcare. I'm passionate about healthcare for those who have limited access to healthcare. But I'm a firm believer that those individuals who have poor access deserve the highest quality. What we embarked on in the journey that we're presently on was to put together a hospital that takes care of Nashville's, here in Nashville, Tennessee, their most vulnerable populations, provide them the highest quality and a product that is competitive, equal or better to what our hospitals in this community have. And to hopefully we can make an impression or an improvement on their health outcomes because we exist in this community, they trust us, and they feel that they have good access to care when they come. There has been continued conversation about closure, and we have put in not only on the quality side, but we've put in the things that fiscally make the organization stronger. We've had to deal with both the legislative and the executive branch of our local government to almost sometimes convince them to understand the value of what we do. You can get rid of your public hospital in your community, but you cannot get rid of those individuals who would fall through the cracks. And if you really want to hold yourself out as a city who cares about all people within their populations, you have to make sure that you have a viable public hospital option for them. So we've been able to fiscally improve how we do business, improve the reputation, and slowly change the community's perception and understanding of who we are, what we represent, and that we're not a drain on the city's finances. We're actually an asset to the city to take care of the people who come through our doors. There are times when you look at where your organization is compared to where you knew it was, and you say, that's not, I didn't necessarily do it, but I created, my leadership created the environment for these people to flourish and accomplish. To watch the quality in this organization and the attentiveness to quality and customer service, and then the people see it, the value of what I've been pushing since day one, and that was demand excellence. Those were kind of my catch slogan that I had everybody. Demand excellence. That's from yourself, and demand it from your coworkers. And don't let that person sit beside you and do a half job. Tell them that if they're going to work beside you in this organization, we're going to turn this place around. They too have to carry their share of the load. They too have to smile. And to look back and for the organization to now stand back and say, we're a different organization than we were, are those kind of things that drive me, because that's a kudos for me. And I just get a little warm smile because I know at the end result the patient's being served better. What I put out there is the vision of what we can be, vision of what we will be, and then the organization puts together the structure as to how to accomplish that. And it's not scripted by me step by step, but it's buying into the vision and then actually making it happen. And those are the things that I go home and I smile, and it's fun to watch. We have to transform ourselves into an entity that at the end of the day, when healthcare and insurance reform takes place, that we're standing at the table providing care that's at or above those in our community, and then we'll be fine. And there will still remain a percent of our population who won't have insurance or good access. And the stronger we are financially, the stronger we are from a reputation standpoint, we'll still be able to take care of those individuals. There'll still be those who won't have coverage. And they're going to need strong institutions that aren't necessarily beholden to bottom line or stock prices, but who also have a community concern for those individuals that may fall through, either by their choice or don't qualify. I've always, even when I was practicing surgery, I practiced here as part of my role, because making a whole lot of money is one thing, but making it and ignoring the vulnerable population, to me, that money's not worth it. So that was a driver for me to make sure that I participated in those who have difficulty getting access. In my role today, I can do it on a broader scale. I can provide my same moral values, my same understandings to a broader population, and make sure that you have an institution versus just one doctor. I now can provide a whole institution of doctors and nurses who can share that same vision that I had as a single person. So I think it's the same, it's just multiplied greater than I could have ever done by myself. This is a different generation, and this generation doesn't have this necessarily same appreciation that former generations do. This generation's driven by different incentives, and you have to put that in through the noise of the greed and all of that exists in this current generations, who they put out there as their role models. Their role models don't, giving back is not, it's how much I can get and how much bling. So that's what it drives their role models in today's society. So to be able to even provide that example through all of that giving back to the community, giving to others, is more important than any flash in the pan that you can amass. Sometimes you set your expectation based on who you serve. And if we have a lot of homeless in this organization, there was this underlying feeling that we only have to be so good. And I fundamentally disagree with that. I think that we set our goals of how good and how great we want to be, and then it is something that no matter what part of society that you enter through our doors, you deserve the best. And I would think that I would ask anyone watching this to challenge those biases that are within, that people in need are there because of choice. It's not always the case. And that people in need who don't necessarily have in this society, they deserve the best.